Good morning, everyone. Thank you, Julie, for asking me to speak. I have to name, I still get very nervous talking in front of people, but I'm excited to be here. I'm going to be talking to you today about neurodiversity affirming practices. So I'll just start with a little introduction of myself. I'm Kelly Weatherwax. I'm a speech language therapist and I work at the Helix School in Marin. The Helix School is a non-public school. It's an NPS. So if there's not an appropriate accommodation for a student, they can be placed at our school. We also have private pay students. I work with mostly autistic individuals ranging from ages 5 to 20. We just recently started a early elementary program. So we have real littles, and then we have a transition program that goes up to 22, but currently my oldest student is 20. I always like to start by saying that I am not an expert in neurodiversity. I am learning and unlearning just like everybody else, but I am very passionate about this topic. I care about it and I think it's important. So that's why I'm here talking about it with you. So some of you may not know the role of a speech therapist, so I wanted to talk with you a little bit about that. We do a variety of different things. We assess and diagnose communication disorders and swallowing disorders. Generally, speech therapists go, there's a few different directions that you can go, but generally you work in education or you work medical, maybe working in a hospital, working with, swallowing disorders, traumatic brain injuries. And then, of course, in the school setting, working in gen ed schools or NPS or private practice. We treat and provide therapy. So speech therapy, maybe someone with articulation or voice. Another small niche area is gender affirming that a lot of speech therapists have been working on. Language therapy, so maybe someone that has an expressive or receptive language disorder or delay. We work in cognitive communication therapy, so maybe someone with auditory processing or executive functioning, that sort of high order thinking. And then, of course, again, the swallow therapy. We use a variety of tools, but we might be using low-tech AAC or high-tech AAC like communication boards or iPads for communication. We work in prevention and early intervention. We might be implementing programs and activities that are aimed at preventing communication and swallowing disorders, particularly in high-risk populations. And we provide early intervention services to young children to address speech and language delays and disorders at an early age. This we know is extremely important because the language development is so critical in young individuals, and there's so much evidence to show that early intervention has been very successful. And then we work in pragmatic language skills, so maybe conversation skills, perspective taking, and so on. And that's just a very small picture of what we might do. So I decided to ask some of my students what neurodiversity meant to them. It's really important to me to include their voices in anything that I talk about. So I asked them what neurodiversity meant to them and why it's important to talk about. I loved all their answers because it was so on point with who they are. One student said it's autistic people or people that have different brains with brains than neurotypical people. And it's important for adults. It's important for adults to understand and spot early signs of autism so kids can get what they need. And for kids, it can help kids stop bullying, maybe not now, but over time. As you might imagine, a lot of the students that end up at Helix have had quite a bit of trauma being in a gen ed school. So I loved that he shared this part. And it was interesting because he stopped for a minute and said, oh, I don't think it will stop the bullying. And then he said, you know what, maybe over time it will if we really start talking about it. I thought that was really beautiful. Another student told me it's the diversity of the brain. And when I asked why it's important, he told me, so we don't have a boring world. I thought was lovely too. This one was so on point for the student. He said it's the dictionary definition. And when I asked him why it's important, he said, is it important? Which I thought was cute. So, and then the last student I asked, he said it is the base of how neurodivergent people act. And it's important because it helps autistic people and neurodivergent people communicate their differences. The student is 9 years old and he helped me edit all my slides. He's incredible. So sorry, I'm just going to take a little sip. I actually had 2 of my students help me with my slides because, again, I think it's important that they're included in this. So I searched for a definition that I liked, that I thought encompassed neurodiversity, and I found this from Harvard University. Neurodiversity describes the idea that people experience and interact with the world around them in different ways, that there is no one right way of thinking, learning, and behaving. And differences are not viewed as deficits. And I found this from Harvard University. So some of you may or may not be familiar with the neurodiversity movement, but it was a political and social movement that began in the 1990s that would advocate for the recognition and respect of neurological differences as a natural and valuable form of human diversity. It challenges these traditional views that we've had of, certain neurological conditions such as autism, ADHD, dyslexia, and other developmental or cognitive differences as deficits or disorders that need to be cured or fixed. So this movement really promotes the idea that these differences should be accepted and accommodated as variations in the human experience. So what does it mean to have a neurodiverse affirming practice? So again, in contrast to the deficit-based approach, which focuses on just fixing or having any neurodiverse person be like their neurotypical peers, the impairments associated with neurodevelopmental conditions. A neurodiverse affirming approach acknowledges that all neurotypes have unique strengths, interests, and support needs. And this approach highlights the role of the environmental and societal barriers that further exacerbate challenges faced by neurodivergent individuals. So what are the core principles of neurodiverse affirming practices? So I'm going to talk a little bit about these, and then I'm going to share with you the ways that I incorporate this into my practice. So we start with acceptance and respect for all neurological differences. We have to value diversity of the brain. Diversity is a big word right now, right? But I feel like we don't talk about the diversity of the brain enough, that, people with autism and ADHD, that they're just natural variations in the human experience. We have to start rejecting this pathological idea. And Julie asked me, I'm a speech language pathologist, but even removing that pathology is important to me because it basically says that there's something wrong with people, right? So removing that, saying therapist for me was really important, even though I can't change the P in the SLP. I don't have that, I can't do that. But so, we have to start doing that by rejecting this idea of people need to be fixed. And then looking at the social model of disability, so barrier removal, focusing on identifying, removing societal barriers and environmental barriers that hinder neurodivergent individuals. I see this a lot in gen ed schools. They are not set up for diversity at all. And I had a slide in here, but I took it out because I didn't want to keep resharing it. But I have a 9-year-old son that's in a gen ed school. And I see that his teacher was trying to talk to him a little bit about the brain and the whole class about the brain. And she sent home one of those sheets of a picture of the brain, and it said right-sided brain and left-sided brain. I was like, oh, okay, she's talking about the brain a little bit, like that's good. But each side had something like horrible to say, like, this side is really disorganized and they're always late and they're always this. And I thought, this is such an archaic way of talking about the brain. Like, it's unbelievable. Why are we still thinking of it as just these two pieces? So, things like that. And in the school system, they have, all the standardized testing that all students should be learning, the same way, which is, it's just, we know it's not true anymore. So accessibility, and promoting inclusive practices and environments that accommodate a variety of neurological needs. This one's really huge, and it's something that I work in a lot in my practice, self-advocacy and autonomy. So empowering and encouraging neurodivergent individuals to advocate for their own needs and preferences, and doing the same with decision making. If you can imagine, most of these individuals have been told what they need their entire life. I don't think that we ask them or teach them how to advocate for themselves enough. And I work really hard when I create goals for my students, that I have goals that empower them. So then looking at strength-based perspective. So this is another big one. It's a different way of looking at how we address individuals in serving them. So looking at their strengths and their unique abilities and the way that they process information, instead of looking at from a deficit, what's wrong with them. Support needs, providing support to address challenges without undermining or overshadowing their strengths. Giving neurodiverse individuals community and a sense of belonging. If you think about all the neurotypical people in this world, there's so much for them. There's sports and groups, and they have pretty much everything. And a lot of neurodiverse people don't have that same opportunity. So providing environments where neurodivergent individuals feel included and valued, setting them up for connections with peer support. This is huge. Respect for identity. So neurodivergent identity, acknowledging that and respect neurodivergent identities as an integral part of that person's self-concept. Language and labels, use respectful and person-preferred language when referring to neurodivergent individuals. Of course, looking at the holistic well-being of an individual, looking at their mental health, addressing mental health concerns by understanding the unique stressors and challenges that they have faced. So some of that, for me, a lot of that is these students coming in with trauma from, being in a general ed school where they've not been acknowledged or recognized, and they have different stressors than maybe their neurotypical peers. It's so important to focus on quality of life. So focusing on enhancing the overall quality of life, including social, emotional, educational, and occupational well-being. Education and awareness. Promote awareness and an understanding of neurodiversity within the broader community. I feel like this is slowly starting to happen at my son's school. And I think a few of the other schools there, they have like neurodiversity week. So they're starting to talk about it, but that's one of the reasons why I'm here, to talk about it with you guys, because I think it's extremely important. I think that's where we start. Professional training. So ensure that educators, healthcare providers, and other professionals receive training on neurodiversity and neurodiversity affirming practices. So how can we put these principles into action? So I'm going to talk a little bit about what I do. I'm still learning, so it's, happening little by little, and of course, unlearning, like I said before. So I prioritize education on neurodiverse affirming practices to better understand and support students. I attend conferences, I read research, I listen to podcasts. I'm constantly looking for the most up-to-date information that I can, so I can be empowered to, promote neurodiversity affirming practices. I focus on developing goals that capitalize on students' strengths, empowering them to reach their full potential and moving away from ableist goals. So I'm not creating goals that are asking a student to be like their neurotypical peers. I'm really, doing self-advocacy and working on goals that really empower them. I include them in decision-making. I value their input. and their preferences, and this really fosters a sense of agency and empowerment. I ask my students what they want to work on. Not all of them can tell me what they want to work on, but I will try the best of my ability. I just recently asked one student, what's important to you? What do you want to work on? What would be helpful to you? And he told me, I have no idea when people are being sarcastic. Maybe you could teach me that. Maybe you could give me ideas of what that looks like. I mean, I thought it was pretty incredible. And I've been starting to do this little by little with my students as much as I can. We have to utilize assessments, for example, the DASL, which I'll talk about, and questionnaires that highlight a student's strengths rather than focusing solely on their, I put weaknesses by mistake, but areas for growth is what I meant to say. This provides a more rounded view of the student. I have attended so many IEP meetings with school districts where there's so much focus on what the child, what's not working for them, and not talking enough about their strengths and what they do well and what they want to work on. And it's, I mean, I'm sure, I don't know if some of you have been in IEPs, but it's really hard. And it's really, to me, it's sad to not have something that really shows the students' strengths. So I'll talk a little bit more about the DASL, but I will say this, it is really difficult to find assessments that are appropriate for neurodiverse individuals. All of them are created for neurotypical. So it's been really hard. And this is a challenge that I face in my practice. Promoting interest-based learning in the classroom and in the clinician, in our speech room or whatever, this really increases motivation and engagement. We have so many teachers that do so many incredible things that, you know, that are interest-based for the students. We might have a student that's really into Disney or anime or D&D, and we somehow incorporate that into the classroom and into their learning. I have one student that's loves Pokemon. So every time she comes in, I do a Pokemon movement, and every time she's so much more engaged and excited, and seeing her smile doing something that she, you know, that she loves. Implementing interventions such as social optics, which I'll talk a little bit about, and interoceptive awareness to support our students in navigating self-regulation, self-awareness, and problem solving. Interoceptive awareness, which a lot of occupational therapists work on that, but it's really teaching an individual what's going on in my body. What am I feeling right now? What are these sensations that I'm having? Where am I having this? This awareness helps individuals better advocate for themselves. We're giving them the language and the tools to, you know, look introspectively. And then I'll talk a little bit about social optics, but this is a neurodiverse affirming intervention that I found, which was very difficult. Again, the assessments and the interventions are very scarce that are neurodiverse affirming. But I found this one, and I will talk more in depth about it in just a moment. Using identity first language, respecting individuals' preferences, such as referring to someone as an autistic person rather than a person with autism. The neurodiverse community has asked that we use autistic person, and it's really important that we listen and include them into what they want instead of just, you know, speaking for them. Working collaboratively to create goals and supports for a student. I'm really lucky that I work in a school that has the occupational therapist, the speech therapist, the teacher, the counselor, the aides, everyone works together. It's not always perfect, but it definitely has the student's best interest because we're all deciding together and talking together. And we might, a student might say, I want to work on this, and there's a way that we can support each other and create goals that will really benefit the student. I feel really lucky for that. We have meetings weekly to come together to talk about each student. This one's a big one for me because I'm a speech therapist, but I think it's important for everyone to understand this. Honoring all forms of communication, whether it's verbal, gestural, scripting, echolalia, Gestalt language processors. So creating an inclusive environment where every voice is valued. For a really long time, scripting and echolalia was viewed as not meaningful communication, and we've learned that it's extremely meaningful, and we need to value it as so. And I don't know if any of you heard of Gestalt language processors, but Gestalt language processors, as opposed to an analytical processor, process language in chunks. So analytical processors process language, one word at a time. So just having this realization that, wait a minute, we don't all, understand language the same way. There are various ways that we might be understanding language. And there's a whole, it's called meaningful speech. And if anyone's curious about it, I can tell you more about it, but they have, courses on, how to address that and how to work with that and how to, best support students that are Gestalt language processors. And I can't tell you how many actual parents have come to me and said, you know what, I actually think I was a Gestalt language processor. So I'm glad that we're talking about it now. So talking a little bit about neurodiversity affirming goals. Rather than writing goals that mask or reduce behaviors or aim for compliance, it's important to write goals that are empathetic and meaningful. So many of the goals, especially when working with the school district, because in particular, they want data. So they want to see that you're, teaching a student how to do something instead of like empowering them. It says internet unstable. Are we worried? No, okay, good. So there are so many goals that I've, adopted when a student comes to me from a school district that are basically asking them to mask. And this is extremely harmful. And I think as neurotypicals, we do this a lot. We mask a lot too. So I think it's very harmful. So moving away from social skills training, all of the interventions, except for the one that I talked about, social optics, are social skills training, just telling an individual you have to do this. There's only two ways that, people react in the situation. It's the neurotypical way or the neurodiverse way, and you have to do it the neurotypical way. It's so harmful, and it's actually not real. So using real life context, like I said, I have a whole range of students. I have some middle school students, I have high school students. I love when they bring their real life situations, or I am lucky enough to observe some of their real life situations because I'm in a small school, so I get to see them and we get to talk about them together. We get to talk about how people communicate differently and why is that important to understand. So the goal, again, is to empower each student rather than forcing them to be like their neurotypical peers. And again, teaching students that everyone communicates differently. Another big thing that I've started doing is putting in my goals at the start of my goal when in a regulated state. And I put, why is this important? It's important because we should never be working on goals if a student is dysregulated or if an individual is dysregulated. We shouldn't be taking data and trying to work on a goal if they're not in a state to work on that. Can you imagine what kind of information you're going to get if someone's not regulated? So I put it in my goals now, and some of the school districts accept it, some of them don't, but I think it's important to state the goal just like that. So again, there are not a lot of neurodiverse affirming assessments. There's very few, but one of them is the dynamic assessment of social emotional learning. It's called the DASL. This is a strength-based informal assessment. You can, find out about their unique needs and, what they're interested in, their employment, which areas they want to go in. And there's 3 parts to it. There is a student questionnaire, a caregiver questionnaire, and a teacher questionnaire. I just have recently started using it in the last year, and I feel so amazing at IEPs being able to share what a student has shared with me about themselves, what's important to them, what they want to be working on. Not all of my students can communicate with me and fill out that questionnaire, but I will try to the best of my ability, because I think it's so important to share their perspective and their assessments. Also, I've had so many beautiful questionnaires back from parents about how they feel about their child, and I get to share that in these meetings, and I think it's really important. I also created and also, of course, the teacher questionnaire, which gives a totally different perspective of what they might be, experiencing in the classroom. And I also, in my hunt for neurodiverse affirming assessments, I couldn't find anything specifically for speech and language. So I created my own that really dives into communication. And I give it to the families. And it's really just, I've seen so many beautiful things that parents say about their kids that I don't know, it's very moving to me. Observation. So I spend a lot of time observing my students in different areas and different contexts. So, maybe in the classroom, maybe on a field trip. I think this is the best picture you're going to get of a student. Giving them a standardized assessment that isn't really meant for them is quite inappropriate. It's not going to give you a really great picture of who they are. I also do language samples, which also gives a very clear idea of how someone is communicating. So I'm going to talk to you a little bit about social optics. So I'll tell you what it is, and then I'll talk more about it. So social optics it equips teens with communication toolkit for social emotional well-being. It's a social communication program that equips teens gives them a set of lenses for viewing social interactions. These lenses improve their perspective taking and problem solving, communication skills, which result in better transition outcomes and employability. The goal is to enhance their quality of life through informed decision making, meaningful social connections, and increased career opportunities. So of course, on my hunt for something that was affirming, I listened to my clinical director shared a podcast with me, and a speech therapist, her name is Carolyn Long. She created this intervention with the University of Montana. So it's actually in study phase. But in the podcast, her and another individual, a neurodiverse individual who co-created this with her. So the entire interface is done with an autistic individual or neurodiverse individual. So she's taking, all of his input and input of, the neurodiverse community of what's important to them. So, and I love the interface, like it was completely drawn by the neurodiverse community. So I was very moved by her because there's very few speech therapists that actually care about neurodiversity. Some of them may talk about it, but really they don't actually, use neurodiverse affirming practices. I was incredibly moved by her, and she came to visit me last year and then just recently. And every time I end up crying because I'm so moved that there's someone that cared enough to, create something that's meaningful and in collaboration with autistic individuals. So this intervention looks at a lot of different areas. So it talks about details and why are details important when we're communicating? Why is it important to look at details when you're communicating? And why is history important when we're communicating? Also, again, that multiple perspectives, that everybody has a different perspective, that there's not just two perspectives, that all these other perspectives might exist and that they're important to know that. Why is missing information important when we're communicating? How might someone misinterpret or misunderstand a situation if there's something missing? The expected and unexpected, like things that may happen in a situation, things that may not happen. Why are ethics and morals important in communicating? And patterns and hidden rules. Like some people don't understand or know about hidden rules, maybe empowering them that, hey, these rules might exist. Why is location and language important when we're communicating? So all of these, each section has, quite a bit of information. And then each student goes through, listens to different slides, and then they answer questions, and then they have typed out longer answers. And I cannot tell you how many beautiful conversations I've had with my students working in this program. I mean, it blew me away, how they were able to, look introspectively and talk about different scenarios. Because it will ask them, like, how have you experienced this in your life? And I mean, it was so much more, it's worked so much better than I thought that it would. It like outseated my expectation. And then sometimes they can work on it alone, they can work on it at home, but I've seen incredible results from it so far. So I always say this because thinking about neurodiversity can feel really overwhelming. When I was in grad school, my professors were literally dismantling my entire career while I was in grad school. And I kept thinking to myself, what am I doing? Like, how am I going to be helpful? Like I was, I had a neurodiverse professor and I just kept thinking, like, what am I going to do? Like, there's nothing here. Like, I don't think I should be a speech therapist, but I decided that it is important and that my role is to provide a safe environment for students to be their most authentic self. I'm here to guide and support. I'm here to foster the growth of their skills and, that will assist them in having more meaningful relationships and experiences in the world. But, when you start diving in some of the research and some of the advocacy websites, they're overwhelming, especially in a field where there's not a lot, there's not a lot of neurodiversity affirming material. So if you're feeling inspired, I listed some podcasts that I really love. Uniquely Human is, I'm sure maybe some of you have heard of Barry Prezant. He is a therapist that was kind of the first to talk about like echolalia or scripting as meaningful communication. So he has a podcast, and what I love about it is that he has autistic individuals on the podcast. So I love that. Two Sides of the Spectrum is where I found the social optics. The Autism Dad just recently spoke at our school, and he talks about his experience with his son who was nonverbal until he was 5 or 6, I believe. So he talks about that and his experience. And then these are more books. Again, the Uniquely Human, it's the name of the book and the podcast, but I put it at the top because it's pretty good. And then All the Weight of Our Dreams. These are written by autistic people. It's really beautiful. It has short stories. It has poems. It's pretty amazing. And then I listed a few other ones. And then social media, these are people that I follow. These are advocates or autistic individuals. Boho Speechy, she does the Gestalt language processing. So she uses neurodiverse affirming practices with Gestalt language processors. Again, the social optics, of course, the connected parent. So, and this is just more research here. You know, a lot of the research and a lot of funding into research was not funded into neurodiverse affirming practices. So if you're, you know, if you look up research on autism, a lot of it's going to be from the deficit view, and that's where a lot of the money went. And I just went to a conference recently, and I can't remember the percentage that she gave me, but she said that there was so few neurodiverse affirming research. And so hopefully we can shift that. And these are some of my resources. My favorite one is the Therapist Neurodiversity Collective. This is useful for anybody, but it talks about, it's the most sort of up to date of the neurodiverse affirming community sharing what's important to them. And yeah, I think, oh, I'll just put my little favorite quote. So I just love these quotes. It's not our differences that divide us. It's our inability to recognize, accept, and celebrate those differences. And autism is neither a deficit, disease, nor disorder, but simply a different and equally valid way of being. And that's it. Thank you. Oh.
I'd love to just hear more about, you were talking about the goals that you write for your students, and coming at it from more of a empowering perspective versus like it was ableist. Can you just give an example of like what poorly written goal from your perspective would be versus how to write that same goal maybe more?
I was going to put examples of some of those goals, but anyone writing a goal for a student to act or to do something that is more like their neurotypical peers. So, you know, also anything that has to do with eye contact, which is always a huge one. But for example, I would write a goal for an individual. I actually did recently write one. I asked them to do 4 different things. So maybe in a social situation where the outcome wasn't what they wanted it to be. So I asked, so what happened in their perspective, right? Did it work? Whatever, you know, however they reacted. And if it didn't work, what might they do differently? And I think that that's really empowering, and it helps them sort of process maybe a situation where they didn't act a certain way or however they were expected to act. I think that that is more empowering to them. Does that make sense?
Yeah. So instead of like my daughter's goals will sometimes be like in 3 out of 4 occasions.
Yeah. So
if she doesn't get her way, she'll react in
a more appropriate manner,
way.
Which is also that's like social skills training, right? So the 3 out of 4, unfortunately, that is data. So you have to
measurable.
Yes. Yeah. So you have to provide that, but I usually try to name exactly what I'm asking for. So maybe like I'll say like maybe 1 to 2 gestural or verbal prompts, and then I'll say, you know, over 3 consecutive sessions. But that's just the way to track data. And unfortunately, like with school districts, you know, there's nothing that you can really do about that because they want that, you know, data. But yeah, I think moving away from individuals trying to be, you know, this is the way you're supposed to act. This is how you should react in this situation. But that's just not real. Like we don't communicate like that. Like there's so much variety in communication that, you know, telling a student, there's only two ways that this is gonna go, and that's just not true. So writing goals that really empower them to think about, okay, I, you know, blew up in the classroom and like got mad at somebody, whatever they did. Did that work? Like that's what I want to give them. I want to empower them to really think about, okay, so, you know, what could I have done differently? Right? You know, because it's not going to be the only time they're going to encounter that. So how can we empower them to maybe stop, pause, think, you know, how could I do this differently? And I'd be happy to share some of the goals that like neurodiversity affirming goals that I have written. Of course, they're harder for me to think of right now, but that's my goal. You know, there's so many programs that are geared at like the peers program and the no, I forgot the name, but they're all just geared towards this is how you're supposed to be. So, and I think it's really harmful. And actually it doesn't work. So yes, that's that. Does that help?
Yeah.
Okay. Yeah, I'm really sorry. I just realized that at the very end. I was like, maybe I should talk into the microphone. No, it's fine.
Thank you for a very interesting series. Glad I was able to make it down here this morning.
Glad you're here.
I don't have a Helix school room, so how do we find those resources in order to educate ourselves so we can help our children?
Yeah, so I mean, of course, I listed some that you can start. You know, that's a good place to start. I know not everyone has that same opportunity, and unfortunately, there's not a lot of neurodiverse affirming clinicians in the general school. When I was in a gen ed school, I never spoke to the occupational therapist. I rarely spoke to the teacher. I remember SLP was like, what's neurodiversity? And I thought, how does she not know this? So the Neurodiversity Summit is put on every year. It's incredible speakers that talk about, you know, what's happening right now. That's one really great resource. I can give that to you. Yeah, I think it may have already happened this year, but it's incredible. It's 3 days, it's online. They used to do it in person and they may go back to in person and maybe do half and half. But that is, I mean, it's remarkable. There's so many different speakers that can help guide you, especially working through a school system. But I mean, I would start speaking up. I mean, that's if you can, and they may not hear you, and they you know, but if you come informed with, you know, information about what's important, hopefully, you know, they'll start listening. I do feel like little by little it's starting to shift, but we're still kind of far from that. So I will give you the Neurodiversity Summit, but definitely the resources that I put. Does everyone have access to these? Yeah, great. I would definitely use the very top one that I mentioned. That one has so many resources connected to it that talk about, you know, ways to navigate the different systems. But that's what I would do. Yeah, and I'm happy to help in any way. Yeah.
I don't have a question, but
I was
just
gonna
wanna
say she might be helpful.
From a parent perspective, how, you know, like when you're adding IEP, like that's my passion. I do advocacy for IEPs and such, and you can have it. I will Zoom attend an IEP if you ever wanted me to, but you can have it written into your IEP that the speech therapist gets training on neurodiversity.
Exactly.
And you just have to advocate for that. Another thing you can do is request an independent educational evaluation at the school district's expense. And then you can, I was just talking with Kelly about this amazing company that trains neurodiversity affirming speech therapists. So she came in and actually did an assessment for my son's school. And it was the most amazing, thorough, probably I've ever had in a public school reading assessment, and she even wanted to do other assessments, so there's ways you can, at a public school, have these things written into the IEP, so that, they can train their staff, as long as you can prove that it's needed. And I'm happy to help you agree, or anybody who need that.
But for my older one, I've been asking, like, can we do these evaluations? So, like, we can't do them, because if we show she has autism, that's a diagnosis.
No, they
And
can
that's-
absolutely
that's the
screen.
resistance I'm getting.
Well, I would, yeah.
Now where do I go? And they say you need to go back to your medical professional to get assessments. It's I'm on a wait list right now. It's
Right.
about a year and a half just for
Wow.
the 15-minute meeting.
For the school district or with your doctor?
That-
I mean, they definitely can do an evaluation at your request. They can't tell you that it's gonna show autism. They can't say that,
No,
which
no,
is,
diagnosis. We don't do diagnosis.
yeah, but if you don't even have that diagnosis yet. So I think that pushing, so
It's like,
no, it's really I mean, it's so frustrating, and I can only imagine how frustrating as a parent it is. I mean, I would just keep pushing, and Julie is an incredible resource. I mean, she is like seasoned. That's why I told her earlier, I'm like, you are a seasoned IEP. But I would really just start asking and pushing, and you may have to go get a diagnosis, but they can't not give you an evaluation because there's a possibility of, yeah, you know, a school counselor, SLP, they cannot diagnose autism. It does have to come from a medical provider. But if you're not asking for that, you're just asking for an assessment.
and maybe I used the wrong language.
Right.
But they should say, you know what, we can't do this, but we could do this.
Well, they
You
have
know what I
to,
mean? Like,
yes.
I don't know. And she has an IEP.
Oh, yeah,
Right now, since.
Right.
She's doing that. I want to try to capture what we can.
Yes.
Because that's no longer the case.
Right.
Forward with the rest of the kids, because you talked about the challenges of doing that.
it is
There
hard.
is concern for me if we put her in the typical.
Right.
The long-term effect of that.
And exactly, it can be very traumatizing. And because unfortunately, our education system is not set up to support any, I mean, even ADHD, there's nothing. They just, I mean, I'm pretty sure my son has ADHD and all they do is like, he can't focus. I'm like, I do my best. How can I support at home? But like, they're in a classroom with 28 students and one teacher. I mean, it's really exhausting and it's hard and it's overwhelming. I'm sorry that
Oh, that's not even
your main,
that's not even my number.
well, I'm happy to talk to you after also, and I know Julie would also, so.
Maybe as a follow to that, so the physician
Oh.
who doesn't diagnose, I say this,
Autism,
I mean, because there are criteria, that's not my skill set as a epilepsy
Right.
provider. And the physicians that do have that skill set, the waiting list is months,
pretty crazy.
6 months long. So I'm wondering, so parents will come to me and I'm happy to write anything. Right, I mean, it's like, I often say to my family, what do you need me to write? And I
Yeah.
can put a diagram, I mean, it sounds dirty, but what is useful information for you from a medical provider?
What's useful?
Yeah, I'm not a
I
speech
mean-
language therapist, I mean, people are telling me, parents are saying they need speech and language therapy, sure, agreed.
I mean-
But me, I always feel like I'm just someone holding my hand
Doing-
and moving the pen, which I'm fine to do,
Right.
but I also don't know if I'm always doing that to the best, end result.
I mean, I definitely think that if a parent is advocating for it and you're able to do that, then who knows them better? Like information, a speech therapist, when a student comes in, we do our own assessment. So all of that, we will evaluate and, figure out what the need is. But I mean, really just giving them the support that they need. I think that's first, right?
Do you think there's value for a medical provider to, at least last I checked, like neurodivergence is not a diagnosis, right?
right.
But to use that term, is it gaining sort of much
I
like
think so.
autism did 30 years ago?
Right. I think so. I think that that's important, and it is hard because the medical part of it is really what qualifies students for services. So we do have to still hold on to that part right now. But you know, we are shifting some of the verbiage. For example, I don't use high functioning, low functioning. So I might say that they're higher needs or they have less needs, you know, instead of using the verbiage that they're, and I even think with the autism, they've changed it to numbers now, I think too. So yeah, I would say neurodivergent, you know, maybe at what you can see what kind of needs they have, you know, that's really helpful. But I mean, like I said, we're gonna do our own assessment. And, you know, yeah, I think there is value in that.
So can that feed on, so if you do an assessment and you can't make a diagnosis.
Yeah.
But you can create the dots that I can connect to make the diagnosis.
100%.
right?
I mean, it's pretty, I've assessed quite a few individuals, starting from really little to older, and it's pretty apparent what they might need. I don't know, because I will need to spend more time with them. But I do think that, and even that you're saying that, I love that idea of you just putting neurodivergence in there, because it's just slowly shifting that way that we talk about
Right.
it. And I think that's where it has to start, right? Even though we still have to follow this like medical part, which is so hard, but it is what gives students the services that they get. So hope I answered that okay.
Yeah. Thank you.
Thank you so much, everyone.